Hi, I'm Dr. Steve from 180 Health Solutions. If you're clicking on this video, either you already have made an appointment or you're thinking about making an appointment for your knee pain or knee problems, or maybe you have a loved one that's doing the same or in that same process. What I want to do is I want to give a short introduction as to a little bit about why we do what we do, a little bit about why it's so important to take a restorative function towards that knee instead of just jumping to drugs and surgery. And then the third thing, a little bit about how that first visit, what that's going to go like, and maybe what a little bit of the treatment actually occurs. And again, that's going to be different for everybody, but I want to give you kind of an idea to help you to understand. It's not just sending you home with some exercises. It's not just wait and see. It's not just make this feel a little bit better until you can buy time for surgery. And then I also want to touch on some of the different reasons why that knee wears out in the first place, or starts to wear down, or starts to give people problems, because we have a lot of other systems and programs when it comes to addressing the underlying reasons why people have knee problems in the first place. When we think about knee pain, one of the big things we talk about is degeneration. There's a lot of fancy terms, right? Osteoarthritis, degeneration, bone on bone. One of the big things that people often say is, I've been told it's bone on bone. There's nothing that can be done, or it's degeneration and it's just going to have surgery. I'm here to tell you that's not always the case. In fact, it's usually not the case. When we look at these different degrees, right? So there's different degrees of bone on bone. There's different degrees of degeneration. The first thing that happens, that kneecap starts to shift, and then we start to see where those joint spaces start to break down and get worse and worse. Our intention in these first two areas is where we can still help people. Once it gets out into this area here, the likelihood of us helping you is not so great. And the other factor that we talk about is the sooner you do something about a knee problem, the more likely that you're going to be able to be helped. And so this is where I really want to encourage people not to wait, to get in there, get the work done, and then support and maintain the progress and the function that you've made to give you a much better quality of life. I got into this because I had my own knee problems, right? And I had some high school injuries. Things were great. Went to college, was helping out with a wrestling team, and I had another injury. I tore it again skiing. So I had multiple different injuries in the first 20, 25 years of my life. And then things were pretty good for a few years. And then about 3 years ago is when I started to realize, my spine is healthy. The rest of my body's healthy. I'm trying to be active. But this knee is really getting in the way of a lot of things I'd like to do. I remember it was at a Christmas party, and I tried to sit on the floor, and I couldn't even sit on the floor. And I was thinking, man, I'm a chiropractor, I can't move. And so I started this journey where I started to look for other answers to help my knee. I'd done some stem cell treatment, really didn't do much. Did some PT, really didn't do a whole lot either. And then it wasn't until I found the different treatments that actually start to help to heal the joint that I started to regain function. And that function really started to regain within about 3 months. And I realized, we put a lot of emphasis on the health of your spine and the nervous system because that controls and coordinates all aspects of the human experience. We put a lot of time into helping people with food, nutrition, figuring out the underlying triggers behind their diseases or their problems. But one of the things that I hadn't been really taking care of, or maybe dismissive or would refer out for, was knee problems. And I believe that there is a lot more comprehensive approach that people can benefit from, and that's what we strive to deliver here today. So, who gets osteoarthritis of the knee? It can really occur at any age, but honestly, it's more common as we get older, right? Because it is a chronic degenerative condition that will continue to get worse if we don't do something about it. And it can happen in younger people as well. For me, it was probably happened in my late 30s is where I first really started to notice it. More common in women, approximately 20% of all women, and 15 to 20% of all men also have knee arthritis. And again, I would say that with all the different stressors that we put on our body every day is actually getting more and more common as well. So what's the common treatment? I want you to think about what's consistent with these. We can ice it. We can use exercises and PT to strengthen the knee and keep it flexible, okay? I will say that part is really important. Ice, the research kind of, depending upon what you look at, is there any sort of long-term benefits? We don't really necessarily know. There's differing research on benefits of ice. Some says it doesn't really do much. Some says for the short term it can decrease inflammation. But truly, it's not really addressing the underlying problem, right? And helping to heal that joint to actually start to heal. And then pain relievers are anti-inflammatory drugs, things like Tylenol. ibuprofen, naproxen. These are all medications that definitely have side effects, right? And essentially, even if you read the packets, it talks about these drugs shouldn't be taken longer than 10 days due to increased side effects such as kidney disease, bleeding of the GI tract, right? The digestive system, increased risk of heart attack, increased blood pressure, heartburn, nausea. The list goes on and on of the potential problems. Tylenol, we think of it as some inert substance, but it works by actually decreasing glutathione production. And we've probably seen that a lot in different research or different advertisements where we talk about the importance of glutathione and how the body actually works. And so there's definitely potential problems with these, okay? And then what next thing that happens is we can numb that pain, right? The majority of pain relievers, right? What you're looking at is it's like putting tape over an engine light where the problem is still there. It's just allowing you to ignore it while that knee joint continues to break down. Not necessarily the smartest thing to do. The next level that we go to is typically corticosteroid injections and then injections of hyaluronic acid, right? The lubricating fluid that's normally present within joints. Steroids work by driving out inflammation. Inflammation is your body's attempt at the immune system actually trying to heal where there's a problem, right? And the inflammation, there's a reason that it's painful. It's a warning signal telling you there's something not right. So not only are these steroid injections not truly addressing the underlying problem, which we're going to get into shortly, but they can also have serious side effects, right? Maybe associated with faster progression of the disease of osteoarthritis. And again, according to the research here, studies from the Osteoarthritis Initiative collected annual x-rays for 4 years from patients who got corticosteroid shots compared to those in the control group. These x-rays revealed worse arthritis progression in those injected with corticosteroids. Okay, so if you think about it, right, if it's your body's attempt at healing and we're driving out any form of inflammation, it's going to feel good, but it actually causes that matrix, that glycomatrix of the joint itself to break down. University of California, San Francisco looked at MRI scans from participants who got steroid shots compared to those who did not. The research looked at MRIs that were taken at the time of injection as well as 2 years before and after and found more severe cartilage deterioration by the 2-year follow-up among the steroid taking group. Side effects, right? Cartilage damage, osteopenia and osteoporosis, increased blood sugars, right? We see this all the time where it just absolutely throws off people's blood sugars. And then we have to work even harder to help to get the body back to normal again. Causes fluid retention, GI bleeding and ulcers, atherosclerosis or hardening of the arteries, mood changes, joint infections, nerve damage, increased blood pressure, trouble sleeping, weight gain, and eye problems. Probably not something that most people are told when they go in to get these different things. And oftentimes we'll have people have 10, 12, 15 of these over the course of years. These injections were never made for chronic long-term use, right? They were very much for short-term use, just trying to get to drive out that inflammation, maybe a one-time thing, so the body can go back to normal, but it doesn't usually work that way. The longer-term intra-articular corticosteroid injections offer only harm for knee osteoarthritis. So this is from the Journal of Osteoarthritis and Cartilage. Steroid injections may lead to more long-term harm than previously thought. And so as more and more research comes out, the more and more we recognize that maybe this isn't the best approach. A knee replacement, okay? Average cost for knee replacements, $31,000, according to a study by BCBS, Blue Cross Blue Shield. And so when we think about this, right, this doesn't include all the downtime, the loss of work, the loss of jobs, the long-term implications, right? Less than 10 to 20%, approximately 10 to 20% less for a partial replacement on the cost. But we also have to consider the success rate. I always tell people you can never go back from a knee replacement, right? You can always choose or elect to do one later, but you can never really go back once that hardware has been installed, once that joint's been opened up. And so current knee replacements roughly last 10 to 15 years. And I've seen some different research where the revisions or redoing a knee replacement is it's limited on the number of times that you can actually do it. And so something else to very much keep in mind. And again, oftentimes the underlying issue, we have so many people that come in where they had a knee replacement and it didn't really help them. They're still having the knee problems, the knee pain. And I can tell you the predictability of those people getting results in our office is nowhere near the people that had originally avoided surgery or coming in to try to avoid surgery. Why do these treatments not address the underlying problem? Why do people still end up having those problems, right? And we think about it like a vehicle, right? If we think about it, a vehicle that with a nice alignment of those tires, that tire is going to wear nice and evenly. However, if we have structural misalignments where we get a torsion or that knee starts to track wrong, we have a trauma, or we could start to develop muscle imbalances, or maybe we're carrying so much weight where that stress on that joint is simply increased. What happens is, just like a vehicle with a tire gets knocked out of alignment, that it's going to wear abnormally. And that's why you typically see that degeneration on the inside of that knee. Again, that kneecap, the joint, the bottom part of that knee starts to rotate to the outside and then starts to track wrong. So we have this misalignment of the knee joint. Many causes for that. Again, muscle imbalances, excess stress on that joint, right? Chronic inflammation, insulin resistance, right? Excess weight and obesity can be a big thing. So insulin resistance will cause those joints, literally every joint in the human body, to wear out faster if we're chronically exposing it to higher blood sugars. Chronic inflammation, if we're chronically inflamed, this is where we get into some of the food and nutrition in our office, as well as some of the treatment. The treatments are actually designed at normalizing inflammation and directing it towards healing the joint instead of just creating chronic pain. Excess weight and obesity, right? So increased stress on that joint just because we're carrying around extra weight. And that's one of the big things we talk. If we can get rid of inflammation, insulin resistance, and reduce that weight, that's going to play a huge role also in helping you heal. We don't make people do that. We don't require that as acceptance into any of our programs, but we definitely do highly encourage addressing those if that needs to be done. Arthritis can develop in several months to a few years. So again, what are we looking at when we get into looking at whether or not we can help? So I think obviously covering that briefly gives us an idea, hey, we really need to look at those underlying causes, but then also what can we do to restore function of that knee? Can we even help in our clinic? So when someone comes into our office, what are we doing, right? What is this going to look like? And so when a person comes in for their first appointment, this is what you can generally expect, right? Doesn't mean it's going to exactly go this way because our job is to treat you as a person. But we start out with a consultation history. I want to know more about you. We want to know more about what you have going on, what those contributing factors are, so that we can help with those contributing factors. We look at how can you move, right? There's going to be some basic functional movement evaluation, and then we're going to redo that at the end of your first appointment and check for changes, okay? We do some basic testing to rule out any other causes of the knee problem and also to check for safety, right? We want to make sure that the trial treatment is going to be safe for you. We do some x-rays. I want to see the structure and alignment. I want to see how much degeneration there is in those knees. And then considering everything is safe to be moving on, we continue with the trial treatment. After that trial treatment, we run through and we do the same movement as you were doing before, and I want to see a change. And so you guys, we're not numbing the tissue, we're not basically making it so you just can't feel what's going on inside of you, which most of the medical approach is going to be, hey, let's numb the pain, let's try to drive out that inflammation and give you temporary fixes to a long-term solution. We want to see if we're actually able to increase function. And then if we can, then I'm going to sit down and I'm going to put together a care plan for you, figure out what we need to do, figure out what that looks like. And then we sit down with you knee to knee and go through that together with you and your loved ones, where we cover what do we need to do, right? Number one, what's going on with your knee? Can we help? Right? If we can help, I'm going to let you know that too. And then how much time? What does this look like from a cost perspective? Again, everybody's going to be different. Depends on severity of degeneration, depends on a lot of different factors, okay? And then also during that time, we may give additional direction. What that looks like is, hey, Dr. Steve or Dr. Will, I also feel like if I lost that weight, right, if I could address this inflammation, that I think my knee can recover quickly. Or, hey, I saw this. I also look at all this other stuff that you're doing, right? And I want to get involved with that too. What we may do is set up an extra appointment, because this becomes kind of a lengthy appointment, half hour to 45 minutes with the doctors yourself. And so I want to take the proper time to get you started on that route, to set up the proper testing. So we set up a different appointment for that, whether it's with myself or one of my other practitioners. So what are we going to do when we're actually in the office, right? The first thing is actually looking at that proper alignment, where we're looking at, is that knee structurally in alignment where it should be, okay? And so what I want to see, and part of that is essentially taking, if things aren't tracking right, we get torsion in that knee and things are tracking, we want to take that out. And again, this is not a permanent fix, right? We're helping things to align again, to help us get the knee so it can actually start to recognize how it should be tracking. Again, there's muscle imbalances. There's a lot of things that typically need to be looked at and worked on. But this helps. Very oftentimes, this is one of the key missing pieces, right? And again, what we look for with that trial treatment is anywhere from 12 to 72 hours of improved function. Oftentimes people are a little bit longer than that, but again, we're not looking at fixing the actual problem on that first visit. We're looking to see how you're gonna respond, because the only way to really make long-term changes is with repetition, and that's how soft tissue changes. It takes time and consistency. Next thing that we may be doing, right, this won't be at your trial treatment, but this is part of it, is there's 13 muscles that support and stabilize that knee joint itself. There's some different practices a person can do to help to stabilize that joint itself. When we talk about strengthening, and it starts to, the technology we use fires at a very similar wavelength to what your nerves fire at, and that helps us start to strengthen and stabilize the different muscles that are in and around that knee. Because oftentimes we're so unstable that doing active exercises can actually be very harmful. What do we do to correct knee issues? The third thing is, one of the things we do is our knee on track, right? So what this is, it's a specialized table that actually works to decompress that knee joint. A fancy term called a proteoglycan matrix. It's a fancy term. I just like to say it. There's materials inside these joints that, when we start to traction, we start to get motion in there, it helps to refresh that matrix and helps to improve the internal health of that joint. What the research shows, again, this isn't just air. There's your meniscus. There's different materials inside that knee joint. What the research shows is, if we can get even 1 millimeter of increased joint space, it's enough to make a profound impact in how that knee functions. And one of the things you'll notice is we use what's called stacking, where we're stacking different treatments on top of each other to maximize efficacy and to get the most amount of healing out of it. We really love the knee on track machine, and it's one thing that I always mention as well up front, is that we do it more intensely up front, just like everything. It typically takes about 3 months for tissue to break up scar tissue and to actually start to get any sort of healing going. And so for a period of 3 months, we're seeing people more intensely, and that varies depending upon the case. But that being said, we do recommend a degree of maintenance over time to help to make sure we're continuing to decompress that joint and help to support the different tendons and ligaments in and around the knee joint itself. So what else? So laser therapy. One of the really amazing things that we've started to use quite a bit, that I've become a huge fan of, is laser therapy itself. Laser helps to decrease inflammation. It helps the mitochondria inside those tissues to actually start to produce energy so that we can start to heal again, and it increases blood flow, okay? So those different aspects of the knee joint itself. Remember, knee joints, because they're a joint, they don't typically have a blood supply. So we got to figure out how to get nutrition and how to get things into that knee. And so we use what's called shockwave therapy. Shockwave therapy can be really helpful at decreasing muscle tension, improving functional, decreasing inflammation, and increasing collagen production in the joint itself. So shockwave alone is shown to be better than placebo, better than corticosteroids, and also void of long-term problems. So this is the thing, you guys, the treatments we do, they're not there to make you feel better while the problem continues to progress. What the treatments we look for is, what can we do to increase function and to help to stimulate a healing event in the body? Shockwave creates microtrauma into that area. It uses sound waves to create microtraumas, which will restore blood flow to the area, okay? There is research that shows it also helps to deliver stem cells into that area, which stem cells can have the potential of becoming new tissue. We don't ever advertise that or say that that's going to happen. But what the research shows is that, yes, we can get an increased delivery of stem cell into that joint itself, as well as increasing that blood flow. And then when we add the laser therapy onto that, it further increases blood flow. So we're getting as much nutrient into that joint as we can, while we're adding the decompression, adding the adjusting, and then helping you to get things moving at home. There is a degree of home expectations, okay? Takes roughly 30 to 45 minutes, probably 30 to 40 minutes per use or per day. And the more a person can be doing that, the better off we are. What other testing may or may not we discuss? Again, this stuff isn't a requirement. We let you know if it is a requirement. If I don't feel like I can help you without getting some of this stuff handled, we'll talk about that. One of the things, weight loss. So getting rid of extra weight. So this gentleman went from 270 down to about 210. He was also a full-blown diabetic. It was all sorts of pain medications for migraine headaches, joint pain, inflammation, arthritis. Medication-free, body fat percentage looking great. Again, we see this all the time, right? And this is one of the reasons I like to use our testing, because if you think about decreasing the amount every time we take a step, decreasing stress on that joint, decreasing 60 pounds is going to be a really big difference. Visceral fat, fat around those organs, again, that's going to create a lot of inflammation elsewhere. There's a lot of when it comes to systemic inflammation that we want to make sure we're addressing. Reduced muscle strength is associated with insulin resistance and type 2 diabetes with osteoarthritis. So we talk about this too, right? If you have insulin resistance, you're going to have another strike against you. And so when we talk about strengthening, we talk about making sure that arthritis doesn't progress. We really want to address if we have insulin resistance happening, to actually teach you how to work through that on your own, to normalize or reverse the insulin resistance. And oftentimes people are able to put their diabetes into remission, or however you want to say that. Elevated C-reactive proteins. If you've never had a CRP done, everybody should have this yearly, okay? CRP is looking at a level of systemic inflammation in the body. And so those are associated with local joint inflammation, okay? The more inflamed you are everywhere, right, the more that joint is going to be affected. Small injuries become big injuries, or you become a lot more aware when you're inflamed everywhere. Oftentimes we'll get people started and then we'll add in food and nutrition, or even before we can get started, we'll add in some food and nutrition. And next time we see them, as we start getting rid of the inflammatory foods, they'll tell us, hey, I got to say, all my joints feel better. My knee still hurts, but all my joints are starting to feel better, and I feel less inflamed. I feel less stiff everywhere. And so adding that in is a major component in getting the most out of your time here. So again, that first visit, that's what that's going to look like. Looking forward to meeting you, and I hope you have a great evening.